Today we will be discussing dietary interventions in stroke. So stroke is a significant burden of disease affecting 1 in 4 individuals over the age of 25 and is associated with decreased quality of life and early mortality. There are many factors which contribute to the incidence of stroke, including high blood pressure, poor cholesterol balance, smoking, obesity, poor diet and sedentary lifestyle. Today we will be discussing dietary changes to reduce the incidence of stroke, their mechanisms, and nutritional recommendations to minimise the overall burden of disease from strokes.
So now looking at hypertension. So the American College of Cardiology have come up with these guidelines to address hypertension with a nutritional aspect. So they're quite broad. The focus is on vegetables, whole grains, fruits, and healthy proteins, and lowering trans fats and salts. But we can go a little bit more specific by looking at either the DASH diet or the Mediterranean diet. So looking at the DASH diet now, just the next slide. The DASH diet has a focus on low saturated and trans fat. It's high in potassium, calcium, magnesium, fiber, and protein, and low in salt. The really good thing about the DASH and also the Mediterranean is there's meal plans and websites online, and GPs really know them and use them well. So it's good as osteopaths for us to implement something that's readily available. So looking more specifically at the key nutrients. So calcium is something that's got lots of support for addressing systolic blood pressure. So an oral calcium carbonate tablet with 600 milligrams is really good, or you can look at sourcing it 2 to 3 times a day through high dose foods. And if you do that, it's sitting at that high dose, you can have a drop of systolic blood pressure by 2 millimoles of mercury. So potassium has an interchangeable effect with calcium. Things such as beans and dried vegetables, dried fruits such as apricot are high in that. And blood clotting and healing are really addressed through those food sources. Salt has had some controversy in the research, but generally in hypertensive populations, it's recommended to reduce it, but it's not recommended in normotensive populations at this point. So you really want to make sure you're getting the right population if you're recommending a reduction in salt. Magnesium is a cofactor for enzymatic reactions, and it's important for regulation of blood pressure. And you can find that in green leafy vegetables, nuts, black beans, and whole grains. So if we look at the Mediterranean diet, it also addresses some of these key nutrients, but it looks at inflammation as well. So Muna and Ryan will go in a little bit more detail about how it can be, Mediterranean diet can specifically be helpful. But we know it can work on inflammation. So in a study of 5 million people across about 30 years, they found that high inflammatory diets were linked with higher pro-inflammatory biomarkers and poor blood lipid profiles. So you can actually give out an anti-inflammatory diet list of foods and vegetables, and that can have a good effect on patients if they adhere to that. And here's what else we will be addressing in the talk.
So simple carbohydrates such as fructose are high in GI and have an easy usage of energy by the body. This is because they're high in GI and our body craves it more. Unfortunately, in excess, these aren't healthy and increase our risk of stroke. High fructose consumption results in high proportions of LDL compared to HDL, and more specifically, small, dense, low-density lipoproteins compared to HDL. Cholesterol is deposited within the intima of our artery walls, which results in inflammation, bone cell development, and atherosclerotic plaque formation, as they are more easily oxidized by the body. Atherosclerotic plaque formation is a leading cause of stroke and contributes to other cardiovascular diseases. Fructose is found in highly processed sweet foods and drinks, so limiting soft drinks, salad dressings, store-bought baked goods, and fast food will help reduce LDL concentration. High-density lipoprotein plays a role in preventing atherosclerosis through transporting excess cholesterol back to the liver, where it is excreted, which limits the oxidization process within the artery walls. HDL also has an antithrombotic effect through inactivation of coagulation factors. There's inconsistent evidence on whether the Mediterranean diet increases HDL numbers. However, it is shown to improve HDL function through a variety of methods, which allows it to better prevent oxidization of LDLs and transports cholesterol back to the liver. These improvements reduce atherosclerotic formation and decreases the overall risk of stroke.
So now we're talking about other risk factor affecting the stroke is high blood glucose and insulin resistance. So Mediterranean diet have been evidence-based that showing lowering the risk of the cardiovascular diseases and diabetes through reducing the markers such as the glucose. It's important to ensure that the consistent balanced diet maintained through avoiding the consumption of the excess calorie. So Mediterranean diet is known by high phenolic rich food such as a polyphenol. So polyphenol impact glucose metabolism by inhibiting digestion and absorbing the carbohydrate. So that means resulting in lowering the blood glucose that coming from the liver or stimulating the uptake of the glucose in the peripheral tissue. So it is Mediterranean diet known as antioxidative properties, which help reducing the glycemic load and bringing the hyperinsulinemia level back to the normal and boosting the insulin sensitivity, which has a positive impact on the diabetic patient as their insulin level are not compromised. Also, other research showed that eating fiber-rich food is linked to increase of short-chain fatty acid that's created in the small intestines and can be improved insulin sensitivity. Furthermore, its Mediterranean diet is effective for diabetic patients as it's showing increasing and improving of the glucagon, the glucagon-like peptide responses in insulin-resistant subjects while improving gut immune function. Next. Also, it have been showing positive impact specifically with type 2 diabetes mellitus. The antioxidant present in Mediterranean diet can be reducing the content of the free radical, which means reducing the damaging effect when there is a chronic hyperglycemia. Stroke recovery also is impaired by insulin resistance, endothelial disinfection, which impair key neuro resilience pathway. That means maintaining the cerebrovascular integrity, stimulating neural plasticity, and preventing neurodegeneration. Next. So other factor is obesity. So obesity is affecting. It can be leading cardiovascular diseases and other diseases such as diabetes. So Mediterranean diet can help preventing weight gain and obesity by reducing the intake of the total energy and the total of fat to less than 30% of the energy because it complains of minimal processing and avoiding ultra food processing. So that will consider as a modulator of gut microbiota composition in metabolite production relating to the development of intestinal and extraintestinal diseases. So when energy intake has been restricted, that can be absorbed in a short term with people who have a high risk of the cardiovascular diseases. To conclude this one, so stroke is an injury to the brain that causes a blood supply blockage, and risk factor of a stroke such as diabetes, high cholesterol, can be managed by eating healthy diet and modifying lifestyle. So DASH is a diet plan intended to lower blood pressure, while the Mediterranean diet is a plant-based eating vegetable and healthy fat that can restrict food processing to avoid the risks of the cardiovascular symptoms.
Here are our references, page 1, 2, and page 3.